Hello everyone, this is Brendon Lundberg, CEO of Radiant Pain Relief Centers, and I'm here today with our own Chief Medical Officer, Dr. David Farley. How are you doing today, Dave?
Great.
Excellent. Well, I appreciate you taking a few minutes just to visit. I want to just ask you a little bit of questions about chronic pain and what the latest scientific understanding about pain is and why it's such a big problem in our country.
Well, obviously pain has been a problem for thousands of years. But one of the reasons why pain is such a big problem right now is because medical science has advanced to the point where, people expect that we can treat most conditions. And there are conditions with pain that we traditionally have not been good at treating. You really can kind of divide pain into two main types. You can divide it into acute pain and into chronic pain.
Mm-hmm.
There's been a theory around about the physiology behind pain for many years, ever since the 1960s, and it's called the gate control theory. And that theory is very good for describing acute pain. And acute pain has a very specific purpose. It's protective. It's designed to prevent us from hurting ourselves further. If you put your hand on the hot stove, you immediately pull it off
Sure.
because of that pain. But chronic pain, which is pain that's typically the definition is pain that's been going on for at least 6 months. Some people define it at 3 months, but 6 months is certainly chronic pain. There's a component to it that just is not well described by the gate control theory. And it's clear that there's a very significant component of the brain itself that is involved with chronic pain.
Mm-hmm.
And in particular with chronic neuropathic pain, which is the type of pain that occurs when a nerve is sending a signal to the brain inappropriately. In that situation, the brain starts becoming actually focused on that pain, and actually studies have shown that a much greater portion of the brain is actually assigned to dealing with that pain.
Oh, I see. So it grows its awareness about the pain, or its
Exactly.
interest in the pain, for lack of a better term.
Right. Awareness, I think, is a good word to use. Because your conscious awareness of the pain
Mm-hmm.
has significantly increased, and that has to do with the higher centers of the brain, particularly in the frontal lobe. So treatments that have been specifically designed to try to treat the pain with medications or to treat the pain with procedures and to try to cover up the pain have traditionally not been very successful.
Mm-hmm.
If you have a specific condition that you can actually fix, then a lot of times that will help with the pain. But
Meaning surgically or
right,
tissue.
something along those lines.
Yeah.
But if you have a situation where chronic pain has set in and the brain is a significant component of it, it doesn't really matter much what you do in the periphery. You're not going to really completely relieve that pain.
Mm-hmm.
And obviously one of the huge problems that is developed as a result of that is our primary mode of treatment of chronic pain for the past several decades has been narcotic pain medication,
Uh-huh.
which has shown to have a whole host of problems associated with it, not the least of which is really not any data that shows that it really is effective at controlling chronic pain.
Well, and plus we see this whole opioid epidemic problem that we have that's just become pervasive throughout the nation here and probably throughout the world to some degree.
Absolutely, yeah.
So let me ask you, you mentioned that that this understanding of the brain's involvement is not very well understood or documented. Why is that? Like, where's the disconnect in that at this point?
The history behind that has a lot to do with just the dogma that the brain has, after early childhood, has had no ability to change. And that was, really based on some early experiments that were very limited in their scope and in their focus. And they were just accepted as that's the way it was,
Mm-hmm.
and nobody really questioned it. it's really only been in the last maybe 20, 30 years that scientists have, from a lot of different fields, have started realizing that, wait a minute, the brain can change, and it can change in actually a lot of different ways. And we are now learning that the brain can change as far as its adaptation to its perception of and its acknowledgement of pain as well.
Interesting.
Yeah.
So this is the term we call neuroplasticity, or
Correct.
The ability of the brain to change and to
Right.
learn new things.
The concept of neuroplasticity is the brain's ability to change, and in particular to develop new pathways of transmitting signals and getting a different result than previously was had.
So in other words, changing its perception. So if it's perceiving or it's had this hyper awareness about pain, you can theoretically change it back to a more normalized perception.
That's correct.
Yeah.
Yes.
Okay. So I know you're a very bright individual, if I remember correctly, valedictorian in your undergrad class. You're a humble guy, no? And you were a graduate of a joint program at Harvard and MIT Medical School, correct?
Right.
Yeah. So you're an educated, traditional thinking, I guess in a lot of ways, medical doctor. Can you just tell us why, or I guess maybe help us understand what the level of education most physicians get about pain in medical school as you understand it, and is that changing, and you see that changing, or are physicians kind of laggards in their understanding about what's going on and messaging about the neuroplasticity in the brain?
Yeah. Well, first of all, the teaching in medical school regarding pain is still very, very much drug oriented, narcotic medications, but that's still the primary teaching.
You mean for pain in particular, or just generally speaking?
Just pain in particular.
Okay. Yeah.
But also, other aspects.
Yeah, they're really trained in biochemistry.
Right.
Yes. Okay.
Right. In fact, biochemistry is a required class in medical school. Biophysics is not, and I don't think anybody, very, very few physicians have much experience or knowledge in biophysics.
Okay.
Now that hopefully will start to change, because we are starting to see modalities that are more physical in nature rather than chemical in nature, although they're intertwined. I mean, the nervous system is a good example of that. Although there are very physical characteristics of the nervous system with the transmission of nerve impulses and electrical signals and stuff like that, that usually ends up terminating in the delivery of a neurotransmitter, which is a chemical that is involved in the process. So the concept of trying to separate biophysics and biochemistry really doesn't work. They go
Together,
hand in hand,
sure.
but you can't just do one without taking the other into consideration. And as far as the progress that is being made in chronic pain treatment, it's pitiful.
Because it's all a biochemical approach?
Well, because no one feels that there's a reasonable treatment for it. I recently, just about a year ago, attended a conference in London by the Royal Society of Medicine that was specifically on the treatment of chronic pain. And basically the theme of that seminar was, since we don't have any good treatments for chronic pain, send them to the psychiatrist so they can learn to live with it. That was basically the theme of the conference. And
so our European counterparts aren't really much more advanced in this regard than we are here in the United States.
No, absolutely.
Interesting. Well, talk to us a little bit about what we do at Radiant. We have a seemingly a very effective and safe and efficient way to resolve this chronic pain by, again, addressing the brain, as you've talked about.
Right.
Talk to us a little bit about how that technology works for our viewers out here, and what types of indications we seem to find success with.
Yeah. Well, so the technology that we're using is typically referred to as scrambler therapy.
That's what it's known as in the medical literature,
Yes.
and the FDA paperwork. And whatnot.
Correct.
Okay.
Yes. And it is a technology that was developed by a biophysicist in Rome. And the idea behind it is to actually, rather than trying to cover up pain, trying to mask pain, to actually use the neuroplasticity of the brain to retrain the brain to accept a no pain signal as the norm rather than the pain signal. It's a relatively simple device as far as application is concerned. It's very complex as far as its mathematics and its algorithms and things like that, but as far as the physics behind it, but as far as the application of it, it's very simple. And in many ways, it's like an EKG machine. It's about the same size as a typical EKG machine, and it has surface electrodes.
And they go on the skin.
Right, that attach.
Non-invasive.
Correct. No needles, nothing that causes any discomfort. And rather than something like a TENS unit where you're putting the leads right over the pain to try to just block the pain, this is a situation where we actually put the leads outside of the pain area so that we can get into healthy nerves, so we can send an unadulterated signal to the brain, which is a no pain signal, that eventually the brain can then use to retrain itself to accept that signal.
So it's giving it new information, healthier information, which the brain then starts to retain and learn through neuroplasticity.
Correct. And that's a process, and the amount of time that it takes varies from person to person and condition to condition. But on average, there's an initial 10 to 15 consecutive treatments that we use, and that usually will get a person either out of pain or down to a very, very low level of pain. And after that, there may be a need for some intermittent booster treatments every once in a while.
Like a refresher course.
Yeah, really, in a sense.
Okay.
Yeah, and that just kind of reinforces the fact that this technology really does use that neuroplasticity component to be effective.
Excellent. Well, I appreciate your time. It's been insightful, and hopefully our viewers have gained some added insight into both chronic pain, the brain's involvement in pain, and then as well as the therapy that we do here at Radiant Pain Relief Centers. So
Great.
Thank you, Dave. Appreciate
Sure.
it.